come in.
Good morning.
Good morning.
My name is Angela and I am a physician assistant student for Dr. Beach and I'm here to take care of you today. Could you confirm your name and date of birth for me?
Yes, Jenna Gray,
Okay.
and then it's 10/12/1998.
Great, thank you. And how would you like to be addressed?
Jenna's good.
Jenna is
Yeah.
good. Okay. So what brings you in here, Jenna?
I've just noticed that I've had a sore throat for some time.
Okay.
It's kind of painful when I swallow and everything, so I just wanted to make sure I wasn't contagious or anything.
Okay, well, I'm glad that you're here today, and I'm also glad that you're, conscious about not giving it to other people if it's contagious. So can you describe this pain for me a little more?
Yeah, it's not constant. It's more just uncomfortable when I swallow or when I eat or drink or something like that.
Okay.
So that's my main thing.
Okay. And when did this start?
About 2 weeks ago.
2 weeks ago.
Yeah.
Okay, and does it go anywhere?
No, it's pretty just in my throat, so I
Okay.
don't feel it anywhere else.
Okay, and how long does it last?
It typically goes away right after I swallow or
Okay.
eat. Yeah.
So you're saying it's only when you're swallowing?
Yeah.
Okay. Have you noticed if swallowing liquid versus solid food makes any difference?
I guess it's easier to do liquids
Okay.
because it's more soothing, and so the solid food's a little bit more painful.
Okay. And have you been taking anything to make this better?
No, I didn't know what to take.
Okay, that's understandable.
Mhm.
Can you tell me if you've had any cold or flus lately?
No.
No? Okay.
Mm-mm.
And what about sinus issues? Any of that lately? Okay. If you would have to rate this for me on the scale of 1 to 10, 1 being very mild and 10 being very painful, what would you rate this?
I would say about 5 because it's manageable but just
Okay.
uncomfortable. Yeah.
Uncomfortable, is
Yeah.
that okay? And has it affected your life in any other way beside uncomfortable while swallowing?
I guess I avoid eating more because I don't like that feeling.
Okay.
But that's about it.
Okay, well, I'm very sorry to hear that, and we'll try our best to alleviate this pain for you. Yeah, you're welcome. So I also wanted to ask you if you have had any strep throat recently, or
Not that I know
okay, never diagnosed with it.
of. No.
Okay, let me just summarize what you said just to make sure
Okay.
that I understood everything correctly. So
Mhm.
you're in here today for your sore throat, and it's mostly discomfort than it is painful.
Mhm.
And the only time it's painful is when you're swallowing your food, and it's worse if it's a solid food versus liquid. It's been going on for 2 weeks, no other pain anywhere else, and your sinus is fine, no previous history of cold or flu, recent history of cold or flu or strep throat, and you've not been taking anything for it. Did I get all of that right?
Yes, perfect.
Okay, and you said it was 5 out of 10.
Yes.
Okay, I would just like to go over some of your past medical history just to get better idea.
Okay.
Is that okay if I ask you a few questions?
Yeah.
Sure, thank you. What about your general health? Can you tell me overall?
I think it's pretty good, generally. I don't have
Okay.
any major problems that I
Okay.
see. Yeah.
Okay. Were you diagnosed with any illnesses growing up?
Not as a child.
Okay.
No, not that I know of.
Okay, what about when you were adult? Any illnesses?
I was diagnosed with anxiety when I was 18.
Okay.
But I take medications and I go see a psychiatrist and manage that well. So I feel pretty good about that.
Okay, I'm glad to hear that it's managed right now.
Yeah, thank you.
You're welcome. What about your psychiatric illnesses, other psychiatric illnesses other than anxiety?
No, I feel like I'm pretty good there.
Okay. And have you ever been hospitalized in the past?
No.
No. Okay. What about accidents or injuries?
I broke my leg once.
Okay.
I was like 15 or so. But it healed well and I don't have any problems with it anymore.
Okay. What did they do?
I got an x-ray and they just saw that I was chipped, so I went through some physical therapy
Okay.
and like bore a brace, but it's good now.
Good now, no issues with
No.
that. Okay.
Yeah.
Oh, I'm glad to hear that.
Thank you.
What about your women's wellness, like your reproductive health in general?
I know that I need to get a pap smear still, but I haven't done it yet. But I am planning on making an appointment.
Okay, I'm glad that you're thinking of it because you're nearing that age now.
Mm-hmm.
Yeah, it's important to take care of yourself.
Yes.
And are you taking any other medications right now other than the one for your anxiety?
No, just the fluoxetine for the anxiety. That's it.
Okay, and it's been working well for you, right?
Yes.
Okay, and any allergies to other medications that you're aware of?
No.
Okay, what about environmental allergies?
Sometimes with my cat, I
Okay.
get some allergies, I think.
Okay, do you take anything or do you do anything to?
No, I don't do anything for it. My
Okay.
eyes just itch a little bit.
Okay, well maybe like washing it might be helpful sometimes.
Okay, thank you.
Yeah, you're welcome. What about food allergies?
No food allergies, no.
Okay, and are you up to date on your vaccine?
Yes, I just got them all done for school, so.
Okay, good, and that includes COVID vaccine too?
Yes.
Good. What is your diet like?
I'd say it's pretty good, well-rounded, no complaints.
Okay.
Eat 3 meals a day and everything.
Okay, so healthy
Yeah,
meal.
yeah.
Okay, and are you physically active?
Yeah, I try to exercise about 5 times a week, usually for an hour. I like to walk and stuff, so.
Okay, that's good. And what's your sleep cycle like?
It's good, I can sleep, so no problems there.
Okay, I'm glad to hear that. And are you careful of taking all of the safety measures when you need them, like seatbelt or wearing helmet when you're riding a bicycle?
Yes.
Or even sunscreen?
Yes, I wear
Okay.
sunscreen.
Good, I'm glad to hear that. And the next few questions I'm gonna ask is about like the tobacco and alcohol use, things
Okay.
like such. Is it okay?
Yeah.
Okay, so are you using tobacco in any form?
No.
Okay, or in the past, have you?
No.
What about smoking? Do you smoke anything
Mm-mm.
in the past? No. Okay, and alcohol?
Occasionally for like weddings and going out to eat, but
Okay.
not often.
Okay, and how much do you drink when you do?
About 2 glasses of wine.
Okay.
That's probably what I'll do
Okay.
typically.
Okay, and are you using any illicit drugs? Or?
No.
No. Okay. Also, now I want to move into the family history just to get more idea of your family background and illnesses, any like related illnesses if there are any.
Okay.
Is it okay if I ask you a few questions about that?
Yeah.
Okay, thank you. Can you tell me if you're worried about any illnesses that might run in your family?
I'm not worried about any, I don't think.
Okay.
No.
Are your parents still living?
Yes, they're both in their 50s and they both have really good health for their age, so no diseases there.
Okay, good, thank you. And what about your siblings? Do you have any?
Yes, I have an older sister, she's 24 and she's healthy, and then a younger brother, he's 20 and he's healthy. He just has asthma, but
Okay.
he manages that.
Okay, I'm
Yeah.
glad to hear that. What about your grandparents?
All my grandparents are still alive. They're all in their mid-70s.
Okay.
And they're all healthy, like
Mhm.
no diseases, like we're really blessed. Other than my paternal grandma, she's been diagnosed with Alzheimer's, but she has a lot of support around her and she's doing pretty well.
Okay, I'm glad that she has the family support that is needed.
Thank you.
Okay, and do you have any children? I know you.
No.
Okay.
children.
Okay. Thank you for answering all of that. And now I want to learn more about you, so I'm gonna ask questions that are about yourself. Is it okay?
Yeah.
Okay. So I know you said like you went to you're in school right
Mhm.
now. Is it a full-time school?
Yes, I'm a full-time PA student. So.
Good. Congratulations.
Thank you.
That must be very exciting.
Yes.
Uh-huh. And how about work? You're not working full-time
No.
student, right?
I'm not working anymore, but I did do in-home healthcare.
Okay. And can you just like briefly tell me about your daily life?
I pretty much am a student, go to school most of the days, and then just go home. I live by myself.
Okay.
I do have my cat, so I feel pretty good about it. Trying to get a schedule, but good.
Okay, good. And how is things with their family? I know you said you live by yourself. Do you have a good support system?
Yes, my family is very supportive. I call
Okay.
my mom like every day, so.
Good, I'm glad to hear that. Now, the next question I'm going to ask you is about your sexual history, and this is something I have to ask all my patients just to make sure that I provide the quality of care. This will all be confidential. So, are you okay if I ask you a few questions about your sexual history?
Yeah, of course.
Okay. How would you like to sexually identify yourself?
I'm female, heterosexual, so interested
Okay.
in men.
Okay.
Yeah.
Okay. Are you sexually active?
Not right now, no.
Right now. Okay. And are you aware of all of the preventative measures that you need to take, or safe sex when you're ready to take that step?
Yes.
Okay.
I know, like, to get on birth control and practice safe sex methods, so.
Okay. And so you also have, do you have any knowledge about STDs?
Yes.
Okay, good. Now, I just want to ask you some very generic questions about your whole system,
Okay.
just to make sure that I haven't missed anything. And this will be quick yes/no questions, but please feel free to stop me if you need to elaborate. Is that okay?
Yes.
Okay. So, how would you describe your health today?
Good. Yeah.
Good. Do you feel tired?
Just normal tiredness from
Okay.
school, but not anything crazy.
Okay. And any fever or chills?
No.
No. Okay. Any dizziness?
Mm-mm.
No. Any headaches that you've experienced lately?
No.
No. Okay. And any vision issues?
I wear contacts, but no changes recently. I go get them checked, so we're good.
Okay. Any other eye problems?
No.
How is your hearing?
Good. I can hear well.
Okay. Any other ear problems beside hearing?
No.
No. And you said your sinus is fine, right?
Yes,
Do you
yeah.
breathe? Do you think you breathe well? with
Yeah,
your nose?
yeah.
Okay. How's your dental health?
Good. I go every 6 months, so
Okay.
we're good there.
Good. And beside trouble swallowing, which is of your sore throat right now, any other swallowing issues that you've experienced?
Not before, no.
Okay. And how's your neck? Is it stiff?
No, I
Any-
feel good.
Okay. Any
Yeah.
pain in the area?
No.
Lumps or bumps?
No.
No. How about your skin? Have you noticed any discoloration,
No.
rash, abnormal pigment,
Not
any
no.
moles that you're concerned of?
No.
No. Okay. And how's your chest?
Good.
Good. Do you breathe well?
Yeah.
No chest pain?
No.
Any heart palpitation?
I mean when I get anxious, but that's just
Okay.
normal.
Okay.
Nothing like scary.
Okay, it's well managed.
Yeah.
Okay, good. What about your breast areas? Like any pain in that area?
No.
Okay.
I try to check, do self breast examinations, so we're all good there.
Good. I'm glad to hear that.
Thanks.
So no lumps or
No,
anything,
no.
right? Okay, good. What about your reproductive health? Like when did you start your period?
I was 16.
Okay.
So, but since then my cycles have been normal.
Okay.
Nothing to note.
Okay. Any abnormal cramping or bleeding?
No.
No. Okay. When was your last period?
It was last Friday.
Okay.
Yeah.
Good. And what about your abdominal area? Any pain there?
No.
How about your bowel movement?
Normal.
Normal.
Yeah.
Okay. Have you been feeling any nausea or no vomiting?
No.
No. Well, how about your urine frequency?
Normal.
Okay. And is it painful?
No.
No. So normal. Okay. Good. And how about like have you experienced any muscle pain?
No.
No. Any tingling or numbness on your face or your hands anywhere in the body?
No.
No. How about your joints?
I feel like they're good.
Good. Stiffness?
Mm-mm.
No. Any swelling anywhere?
Nope.
No. Okay. And you've already mentioned your anxiety. Other than that, is there any other mental issues that you've experienced lately?
No.
Okay. And how have you noticed any bruises in your body?
No.
Okay. Any
Mhm.
abnormal bleeding anywhere?
Mm-mm.
Okay. Any weight loss that you've noticed?
No.
No. And your appetite? How's it like? Good.
Yeah.
Okay. And any hormonal imbalances that you're worried of?
No.
No. Okay. And how is your heat and cold tolerance?
Good.
Good.
Yeah, I would say normal.
Okay. And are you concerned of any thyroid disorders?
No.
No.
Mm-mm.
Okay, well, thank you so much for answering all of my questions. I think from what I've gathered, you're here for your sore throat, and
Mhm.
that's the only issues. Looks like you're pretty much healthy, and that sore throat is mostly discomfort while swallowing than
Mhm.
anything, right?
Yeah.
Okay. Do you think I've missed anything? Is there any question?
No, that's
No.
great.
Okay, I will take all of this to Dr. Beach and then we'll come back for a physical exam. Is that okay?
Yes, sounds great.
Thank you.
Thank you.